There's so much hype today on our appearances. Everybody wants really white teeth. Um, we usually compare ourselves to the movie stars as far as our smiles go, that we want those really, really bright smiles, with the pretty white teeth. But we don't realize that most of them have porcelain veneers or crowns on their teeth. And on those porcelain veneer crowns, they have the whitest of white of the shade of porcelain, where natural teeth are not that color. In natural teeth, you have some yellowing, and you have some what we call radiolucency in the teeth, because you have the shadowing from the back of the mouth. Well, most everybody nowadays wants a really white smile, so they've got into bleaching, or what they call bleaching of the teeth. Either you've learned about it on TV, or you've learned about it in a magazine that you've read, or you've learned it in a dental office that you've gone to. There's all types of bleaching. There's all types of delivery systems. But the question is it safe? Is it harmful to our enamel of our teeth? I've read numerous magazines, articles for the ADA, and all the different ones, and it's a very controversial issue. You have some dentists say that yes, it is. Some say that it's not. In those cases, we could look at some of those in the types of delivery systems. They say that causes the damaging to the tissues. It's not necessarily the actual whitening of the teeth or pulling out the stain of the teeth. It's actually the periodontium that's around the teeth, which is like what holds the teeth in their socket. You've heard of pyorrhea or periodontal disease. There's a controversy there. There's a controversy, is it safe for, the amount of bleach that you're getting in your system. They talk about that a lot. But let's look at it. Okay, the tooth structure is made of several surfaces. The outer layer is enamel, and that's where the stains get into the teeth. They go through there, and the tooth is porous, kind of like bone. It's got tubercles in it. And in that's how the bleach, or what we call peroxide, carbide peroxide. It's not actual bleach. It's not like the bleach you use to wash your clothes with. It is a type of peroxide. It is a chemical that you are putting in your system. But how it works is it goes down into the tooth, and it pulls the stain out of the tubercles. And then over time, the tubercles close back. That's how teeth are. They're just in layers. It's not like your tooth is just a solid piece and the enamel is going to wear away like they talk about it. Most layman's people can't understand that it's layers. You have layers of the tooth. You have the enamel, the dentin, and the cementum. On the top layer, you want to keep the enamel if you can. But with bleaching, it does not wear it away. They do say over long-term use, like if a patient is like overly excessive and they use it like more than they should, for long-term, like, years, they're not talking about months. They're talking about years of using bleach every single day. Yes, it possibly could damage your tooth structure, but the likelihood of it is not. And then let's talk about the periodontal disease. Now, if a patient has problems with their gums, which is the periodontal that holds the tooth in place, there is concerns there, because bleach is a medicine that you're applying to the outside of the tooth. Could it damage the tissue around it? Sure. The gingiva part, the bone part, they're not really saying yes or no to it. They go back and forth with that. It is harmful if it's an excess, if you have it in your body for a long time, I'm sure. But as far as, if a patient has periodontal problems, it's up to the doctor to really, under his discretion, whether the patient should continue use of it. There's lots of better ways of bleaching the tooth. You don't necessarily have to use like the trays that they make. They actually take an impression of the teeth and they make a tray for the patient to wear while they sleep with the bleach in their mouth. You just put it along the inside of it. Well, then you have your toothpaste, Crest 3D whitening. You have Colgate has a brand, that Zoom White has a brand, and in the Zoom White, that's the actual light, the light cure in the office. You can have that done that way. They say in that long-term use of those things, you can get sensitivity of the teeth. Yes, it can irritate the periodontal disease if you use it for long terms. But as far as is it hurtful to the enamel of the tooth? No, they're not finding that. It does not break down the enamel of the teeth over time. They say that The benefits outweigh, the harmfulness of it. They say a patient shouldn't use it, in excess, like, how some people get compulsive disorder, and the doctor sees that in the patient, they should recommend that the patient stop using it. Don't use both upper and lower trays at the same time, because you can get overdose like any medicine. You have to treat it like any medicine that you give a patient, and the patient should be aware of that. You should make them very aware that it is poisonous, because it is. Anything in excess in the body is a poison to the body. Bleach, though, when we say bleaching, it's not bleach. It's peroxide in high doses. When I say high doses, it's between 10% and 35%. Now, they also have a bleach that they use on patients who have root canal, darkening of the teeth over time, or they had trauma as a child and they had to have a root canal done on the tooth. They take a higher dose of the peroxide or carbon peroxide and use it down inside the surface of the tooth to instead of being on the outside taking the stain out, it comes from the inside and takes the stain out and lightens the inside of the tooth, so you can actually have a lighter tooth, after a root canal procedure. So to be honest and understanding of, bleaching your teeth or using whitening or Zoom, the actual light of the tooth, the lightening of the tooth in the office, it has more of the better qualities. It's not as harmful. It's not harmful to the tooth. It is actually probably better. And it is a cosmetic thing. And I feel like, on my point of view, I think that bleaching is a wonderful thing for a patient. It doesn't take away from the enamel of the tooth. It's not harmful for the patient to use it. And the best thing is, in the end of the day, just remember your smile.